Well, good morning, everyone, and thank you for being here. My name is Andy Fillmore. I'm the Member of Parliament here in Halifax. It's a great pleasure to be with you at Dalhousie University. And Dalhousie, thank you for having us. Dalhousie is located on Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people, where we are all treaty people. You know, this past year and a half has put a spotlight on our healthcare system. It's also put a spotlight on the talented and hardworking people that work within our healthcare system, putting on scrubs, putting on their lab coats, going to work every day to keep us all healthy. You know, keeping our public health care system strong during a global pandemic was a Team Canada effort that relied on nurses, doctors, pharmacists, researchers, scientists, and more. From preventing the spread to treating the sick, to securing and administering vaccines, the pandemic showed us that we can take on big challenges when we work together. That's as true today as it has ever been. We need all Canadians to get their vaccine so that we can move forward together. Which brings me to my friend Anita Anand, who is with us today. As Minister of Procurement, she has helped to secure the most diverse portfolio of vaccines in the world. It's wonderful to welcome her back to her native Nova Scotia, to her alma mater, Dalhousie, and to Halifax. I'd like to invite her to say a few words now. Anita.
Thanks so much, Andy, and it's fantastic to be back. I was born in Kentville, Nova Scotia. My family immigrated here in the 1960s and raised 3 daughters here. And if you can just imagine a South Asian family coming to Nova Scotia in the 1960s, it was a fairly rare occurrence, and we settled in a rural town, and I lived there for 18 years, went to school, KCA, and really the childhood that we had in Nova Scotia was idyllic, and I am always so grateful, as are my parents, for the welcoming people of Nova Scotia and just being so wonderful. It has been a fantastic connection that we have had, and that's why it's so wonderful to be back. I came back here to go to law school when my mom and dad are physicians, and my mom was practicing in Halifax at the time, so I came back and went to law school while she was practicing. So as a child, we spent time on Spring Garden Road and at Point Pleasant Park running cross country, and I'm just so happy to be back. Thanks so much for being so welcoming. As luck would have it, I ran for office in 2019 and was appointed to be the Minister of Public Services and Procurement, and many people told me that that was going to be a role where I would learn about government and be able to be in the background for much of my time. And none of us expected the COVID-19 pandemic to hit, of course, and that threw my ministry at the forefront of procurement. And what we did during the pandemic is to climb 3 mountains. We climbed the first mountain, which was the procurement of PPE. We procured 2.7 billion items of PPE for family physicians and frontline healthcare workers across this country. And we made sure that Canadians had the PPE they need. At the same time, we built up domestic industry, and 40% of our contracts by dollar value are with Canadian manufacturers, including manufacturers right here in Nova Scotia and the Atlantic provinces. The second mountain we climbed was for the procurement of rapid tests. We procured 44 million rapid tests, and we've distributed over 33 million of those tests to the provinces and territories, which we are encouraging them to keep using because it's so important to our response to this pandemic. And the final mountain that we climbed was the procurement of vaccines. We procured vaccines from we entered into contracts with 7 manufacturers and procured vaccines enough to inoculate all Canadians by July. While the Conservatives were betting against Canadians, we made sure that we had vaccines in this country. We were told by the Conservatives that vaccines wouldn't arrive till 2030. We actually beat our target by 2 months. We were very surprised to hear the Conservatives explain to Canadians that our vaccine procurements had collapsed. In reality, we are leading the G7, we are leading the G20 in vaccine procurements, and we will continue to provide vaccines to all Canadians. And I will say that it's not just the here and now that we are thinking of. We are thinking of the future for Canadians. We have in place contracts to ensure that vaccines will arrive on Canadian soil as soon as Health Canada approves the vaccine for the 5 to 12-year age group. We had the foresight to ensure vaccines were arriving earlier than planned, right here on Canadian soil, ahead of schedule, and we made sure that we had contracts in place for the long term as well, for boosters, for vaccines for children, for any vaccines that are approved by Health Canada. So just to close, I'd just like to thank you again. Nova Scotia has been an incredibly welcoming place to my family, and I will never, ever forget the incredible people who made us feel so welcome for my entire life. Thank you so much.
Thanks very much, Anita. You and your team have entirely stepped up over the last 18 months, and every Canadian has you to thank for that. So thank you so much. I think everyone in this room knows that when you ask somebody, anyone across the country, what makes them proud to be Canadian, one of the first things that they say is our universal healthcare system. Now, in Canada, we take comfort in knowing that if one of our loved ones or if we become ill, we can get better without incurring thousands or even hundreds of thousands of dollars in medical bills. And we want to keep it that way because to access health care, that access should be based on need, not on what we can afford. Sadly, even shockingly, the view is not shared by our Conservative opponents in this federal election. Yesterday, we saw Conservative leader Aaron O'Toole say that he believes that we ought to bring in private, tiered, for-profit healthcare to Canada. Liberals will not let this happen. Justin Trudeau will not let this happen. And most importantly, Canadians will not let this happen. We cannot create a tiered healthcare system in Canada where the care you receive depends on how much money you earn. That is not the answer to our healthcare challenges. Our party has a different approach. We have a plan that will invest in healthcare for all Canadians, that will work with our provincial and territorial partners, that will support the dedicated, hard-working healthcare professionals who power our system, and that will ensure that no matter where you live or how much you earn, you will have access to quality healthcare. And now to tell us more about this, it's my honor to introduce my friend and the leader of the Liberal Party, Justin Trudeau. Prime Minister.
Thank you, Andy. Bonjour tout le monde. It's great to be back in Halifax. It's great to be back here at Dal. I have two of my younger brothers who studied at Dal, and I got to come visit them a few times and have wonderful memories of being here. Thank you, Andy, for that introduction and for everything you do. For the last 6 years, Andy has been an incredible voice for the people here in Halifax. From standing up for good, affordable housing, to making sure Nova Scotians get the support they need to weather this pandemic, Andy, you're exactly the kind of leader this city deserves. Speaking of leaders, let me give a big shout out to another proud Nova Scotian, Anita Anand. In the last 17 months, Anita has been our Minister of Procurement. In other words, our Minister of Vaccines and PPE, too. From fighting for and winning contracts for Canada to making sure that there are enough doses for every single person who wants one, you've done an amazing job, Anita, and Canada is proud, but Nova Scotia is particularly proud of everything you've done. Merci. I want to thank the physicians who are here with us today. We had a great opportunity to talk with them a little bit earlier about the challenges of being a family physician, both through the pandemic and beyond. We're going to continue to work to support them and Canadians across the country who need family physicians and need better quality of care. Across this province, we have an incredible Liberal team. I can't wait to see what we can continue to achieve together when we're all back in Ottawa. My friends, when this pandemic hit, nobody knew what to expect. Kids had to stay home, missing school days and birthdays, being there to help their parents, being there to make sacrifices. Workers, families, businesses had to change the way they did things, needed to step up, be there for each other. As Canadians were there for each other, support each other. Communities were affected by this pandemic, by lockdowns, by a total disruption of the way things were. But every step of the way, we saw that Canadians knew what to do. I think of the frontline staff at Dartmouth General Hospital, just across the harbor from here, that I had a virtual visit with just a few months ago. They told me about what it's been like to care for the most vulnerable during the pandemic. I think of people right across this province who did their part by wearing their mask, by keeping their distance, and getting your vaccine. Again and again, Canadians stepped up in so many ways. So thank you. Pendant la crise, les Canadiens ont été là les uns pour les autres. Tout le monde a fait sa part et nous, on doit continuer de faire notre part aussi. En tant que gouvernement, on sait que la seule façon d'avancer, c'est de rester fidèle à nos valeurs. Depuis 2015, notre gouvernement se tient debout pour la classe moyenne et pour les gens qui travaillent fort pour s'y joindre. On a augmenté les impôts du 1% les mieux nantis pour pouvoir les baisser pour la classe moyenne. On a sorti des centaines de milliers d'enfants de la pauvreté avec l'allocation canadienne pour enfants. Et pendant la crise, on ne vous a pas laissé tomber. We rolled out CERB and the wage subsidy for families and small businesses. We stepped up with PPE for frontline workers. We stepped in with armed forces doctors for overwhelmed hospitals and care centers. And we did all this because as Liberals, we believe that the only way to move forward is if no one gets left behind. And my friends, that's something that we're ready to keep fighting for. As Canadians, we're proud of the universal healthcare system our parents and grandparents built, where how wealthy you are doesn't determine access to care, where everyone can get the help they need. Et après cette pandémie, on va pouvoir être fiers de ce que notre génération a accompli aussi. On est resté à la maison pour empêcher nos hôpitaux d'être débordés. On a tous travaillé ensemble pour vacciner le plus de gens possible et on est dans les meilleurs au monde pour le taux de vaccination. Ensemble, on a fait du chemin et ensemble, il faut continuer d'avancer. This is our moment to rebuild a healthcare system that works for all Canadians and that our kids can be proud to inherit. We've been sitting down with provinces on healthcare since day one of being in government. Over the past 17 months specifically, we've worked extremely closely with the provinces. And we hear them, that the federal government needs to step up with more funding to make sure people are getting better care right across this country. So that's exactly what we're going to do. Wait lists have grown, and not just because of COVID-19. We're going to eliminate the backlog that has been building for years and reduce wait times for you and your family. We'll immediately invest $6 billion on top of the $4 billion we already committed in Budget 2021 to ensure that provinces and territories can make this happen. So that's the first goal. And here's the second. 7,500. That's how many family doctors, nurses, and nurse practitioners we're going to help hire with a further $3 billion of investment in Canadian healthcare. This is for people like Ahmed and Vanessa, who I sat down with earlier, new parents who found it really tough to get a family doctor. They deserve the best care possible. So that's what we're ready to deliver. Une autre manière d'améliorer notre système de santé, c'est de le rendre plus accessible pour les gens qui vivent loin des grands centres. Il y a trop de gens dans nos régions qui doivent faire des heures de route pour voir un médecin ou une infirmière. Bien, on est capable de faire mieux que ça. Alors, on va investir pour offrir plus de soins à distance et pour recruter plus de médecins, d'infirmières et d'équipes soignantes pour nos régions éloignées. Healthcare is a responsibility of the provinces, and we will always respect that. But we're stepping up as a federal government because we know you need to get care when and where you need it. At the end of the day, that's what really matters to Canadians. C'est le moment de bâtir le Canada qu'on veut tous pour nos enfants et nos petits-enfants. Et c'est le moment de le faire ensemble. Ici, en Nouvelle-Écosse, vous savez ce que ça veut dire de travailler ensemble. Vous savez ce que c'est d'être là les uns pour les autres. Ça se voit bien quand on regarde votre taux de vaccination. Here in Nova Scotia, you've stepped up on vaccines in a big way. In fact, you've got one of the highest vaccination rates in the country. So that's incredible. Keep it up. And if you haven't got your shots, now's the time. And if you have, but know someone who hasn't, start that conversation with them. It's not going to be easy, but the best way to protect each other is to make sure everyone's getting vaccinated. Just as we all stepped up to protect our elders in the beginning of this pandemic, it's now time for us to step up to protect our kids, those kids under 12 who can't yet get vaccinated. We need to get protected to keep them protected. With people across the country getting their appointments, with our biggest employers, with municipalities and provinces all saying, yes, vaccines matter, with St. Mary's University here in Halifax announcing students and residents will have to be vaccinated, Cape Breton University doing the same, and here at Dal, work ongoing about how to keep students and staff safe, everyone gets it. Everyone except Aaron O'Toole. Mes amis, on est en train de finir notre lutte contre la COVID-19. Il faut continuer de se fier à la science. Ce n'est pas le temps de faire la désinformation sur les mesures de santé publique, comme le fait le Parti conservateur. Ce n'est pas le temps de reculer avec les positions dangereuses et irresponsables de Aaron O'Toole sur les vaccins. Non seulement Aaron O'Toole ne pense pas que tout le monde dans un avion ou un train devrait être vacciné, mais il ne pense pas non plus que tout le monde devrait avoir le même accès à un médecin. Just this weekend, we saw that in the middle of the pandemic, the leader of the Conservative Party came out to support for-profit healthcare. That's just unacceptable. I don't know about you, but to me, it sounds like just another way of saying he wants to go back to the Harper era of cuts to healthcare and private investments. Well, that's not the way forward. Not for communities like Sheet Harbour or Middle Musquodoboit. Sean Fraser, our outstanding MP and now candidate for Central Nova, was telling me that these communities had to close emergency rooms because there were no doctors. This is no time for cuts. No time for a Conservative government that would take Canada back instead of moving us forward. And that's what's at stake. This election is about a choice, forward or backwards. And yes, this is a choice, but not just on health. Aaron O'Toole has promised to rip up our childcare agreements with provinces and territories, agreements which will make things more affordable for families. And yes, this includes the one our government signed with Nova Scotia and that I'm looking forward to working with Premier-designate Houston to deliver. Our team, we're ready to keep fighting for you with vaccines, with $10 a day childcare, with good jobs and affordable housing, because we're focused on moving forward for everyone. Votez pour continuer avec du vrai leadership qui a fait ses preuves et qui a de l'ambition, pour un système de santé plus fort, pour de bons emplois, pour du logement abordable, pour un environnement protégé. Whether you mail in your ballot or head to the polls in person, make your voice heard. Have your say. You can go to liberal.ca/mail to find out how you can vote now, and together, let's move forward for everyone. Merci. Je suis content maintenant de prendre des questions des médias.
Merci beaucoup, M. Trudeau. On va commencer la période de questions avec 20 minutes, starting with Chrissy Kirkup with the Globe and Mail.
Good morning. Britain is pushing for sanctions of the Taliban at a G7 meeting. Will you do the same and push for sanctions of the Taliban at a G7 meeting?
Absolutely. First of all, the Taliban are already recognized under Canadian law as a terrorist entity. And when we have our G7 leaders meeting shortly, we will certainly be talking about what more we can do and must do. Okay. Certainement, on est en train de regarder plus de sanctions. Les talibans sont déjà reconnus comme étant une entité terroriste au Canada, mais nous allons parler avec nos homologues du G7 pour voir quelles seront les prochaines étapes qu'on devrait faire.
And what do you think of the fact that Twitter says that a video that was posted by Chrystia Freeland has been manipulated, and now legal counsel for the Conservative Party is asking for an immediate investigation into that video?
What's really important here is that in the middle of a pandemic, Erin O'Toole came out unequivocally in support of private health care in terms of for-profit health care. We posted the entire interview we posted the entire interview in its entirety, and I encourage all Canadians to take a look to see what Erin O'Toole has to say about what he sees on the future of health care. Ce qui est important dans tout ça, c'est que M. O'Toole a clairement dit qu'il appuyait un système de santé à deux vitesses. On a publié l'entrevue au complet et j'encourage tous les Canadiens de regarder exactement ce que M. O'Toole pense de notre système de santé.
Prochaine question.
Bonjour, Louis Blouin de Radio-Canada. Votre communiqué ce matin pourrait avoir été écrit par un ministre provincial de la Santé. Encore une fois, vous voulez imposer des conditions aux provinces. Elles vous demandent plutôt une augmentation significative des transferts. Pourquoi croyez-vous elles n'ont pas ce qu'il faut pour décider ce qui serait bon sur leur territoire, dans leur propre système de santé?
Ce qu'on a entendu des Canadiens d'un bout à l'autre de ce pays, c'est qu'on a besoin d'un meilleur accès à des médecins de famille. On a besoin d'amélioration dans notre système de santé. Et c'est des conversations que j'ai eues maintes fois avec les premiers ministres des provinces. On a transféré des milliards de dollars pendant les derniers mois aux provinces pour aider avec les systèmes de santé pendant la pandémie. Et je suis aussi tout à fait d'accord avec les provinces qu'il faut augmenter les transferts en santé. C'est un engagement que j'ai pris et j'ai hâte d'en parler avec les provinces. Mais en même temps, on sait qu'on a besoin d'être là en tant que gouvernement fédéral pour assurer ces améliorations et on va travailler en partenaire avec les provinces et territoires sur leurs priorités parce que nous voulons tous que les Canadiens aient un meilleur système de santé à travers le pays.
Dans l'entourage de M. Legault, on dit que vous vous dirigez vers une collision frontale avec M. Legault sur la question des champs de compétences. Est-ce que vous étiez en train de vous ennuyer des chicanes avec le Québec?
Au contraire, je pense qu'on a démontré au cours des derniers mois à quel point notre gouvernement travaille bien avec les provinces et spécifiquement avec le Québec, que ce soit sur l'aérospatial, que ce soit pour créer 37 000 nouvelles places en garderie, que ce soit pour l'Internet haute vitesse. On démontre le genre de partenariat qui va livrer pour les Québécois, livrer pour tous les Canadiens. Ces accords qui améliorent et ces services qu'on aide à offrir aux Québécois, ce n'est pas avec le Bloc qu'on a signé ça. C'est avec le gouvernement du Québec. Et on va continuer de travailler dans le respect, dans le partenariat pour s'assurer que les Québécois et tous les Canadiens aient les services nécessaires. C'est ce que le gouvernement a livré pendant la pandémie avec 8 $ sur 10 de toute l'aide offerte aux Canadiens pendant cette pandémie venant du gouvernement fédéral. On a été là pour les gens, on va continuer de l'être. One of the things that has been clear through this pandemic is our ability as a government to work in partnership with other orders of government. We all work together to keep Canadians safe through this pandemic. And furthermore, we demonstrated an ability to move forward on signing historic accords and deals, whether it's on childcare, where we're creating $10 a day childcare right across the country, deals that Aaron O'Toole has promised to rip up because he doesn't believe, apparently, in creating new childcare spaces for families. We've made agreements on long-term care. We've signed agreements on aerospace, agreements on high-speed internet for rural Canadians. These are things that we do together. And on healthcare, the federal government will continue to be there as a partner, including increasing the Canada Health Transfer to make sure that Canadians get the top quality healthcare they need. At the same time, as Aaron O'Toole took as a lesson from the pandemic, the need to move towards more private delivery of healthcare. That's not what Canadians want. Canadians need a government that's going to continue to work in respect and partnership with the provinces to protect our healthcare system and invest in it, and that's exactly what we're going to do.
Next question.
Steve Shear, Reuters. Good morning. Former British Prime Minister Tony Blair said over the weekend that every jihadist group around the world is cheering after the U.S. withdrawal from Afghanistan, and that the country had been unnecessarily abandoned by the West. What do you think of this view, and do you think it was a mistake for the U.S. to pull out now?
My focus right now is on getting as many Afghans out to safety as possible. Canada has been engaged in Afghanistan for many, many years, first through a military mission and now through humanitarian supports. And the entire focus of the Canadian government right now in Afghanistan is on getting people out to safety as quickly as possible, as many as possible. We're continuing to work with our allies and focus on that. That's a conversation I'm looking forward to having shortly with my fellow G7 leaders as we look at what more we can do.
Regarding that, the follow-up, tomorrow when you have your G7 meeting, in general, what do you hope comes out of it? And will you ask President Biden to remain past the August 31st deadline so more people can be evacuated?
Our focus is going to be on getting as many people out to safety as possible. Canada has stepped up to accept tens of thousands of Afghan refugees, people obviously with connections to Canada who've been helpful over the years, but also people who've been fighting for better outcomes for the Afghan people, better opportunities for women and girls, better fairness and justice, that are rightly seeing this as a terrible setback in the progress that Afghanistan has made over the past decades. We will talk about what more we can do and how we can align to make sure we are saving as many people as possible. Demain, dans notre conversation avec les autres chefs du G7, on va parler de comment on peut en faire encore plus pour aider les gens qui sont pris en Afghanistan, qui veulent quitter, qui ont travaillé depuis des années pour les femmes et les filles, pour la démocratie, pour l'amélioration des conditions de vie pour tous en Afghanistan. C'est une situation extrêmement difficile, mais le Canada et ses pays partenaires vont être là pour aider le plus de gens possible.
Next question.
Glenn McGregor, CTV News. Prime Minister, I want to ask about your own government's record on privatization in the healthcare system. There are bottlenecks throughout, particularly in diagnostic testing and eye surgeries. People are increasingly going to the private sector to do that. Even during the pandemic, when the public health system for testing, COVID testing, was overwhelmed, people were going to private labs to get COVID tests. Your health minister did nothing about that. When do you start using the Canada Health Act to stop that kind of privatization? And how can you criticize Aaron O'Toole for suggesting there's a bigger role for that when your government doesn't act against it?
Well, that's exactly the lesson that we saw during this pandemic, that it is absolutely essential that everyone has access to health care, and our universal public system is the best way to do that. We just have to make sure it's properly funded, which is why we're stepping up with $6 billion today that is going to send more money for diagnostics, for the work people are doing to reduce the backlog that has accumulated both during this pandemic and was already accumulating before. We know that we need to invest more money in healthcare, and we need to work with the provinces to improve data sharing and outcomes for Canadians across the country. Those are the conversations we're going to have, and this announcement today doubles down on the Liberal Party's commitment to public universal healthcare at the same time as we've seen Aaron O'Toole double down on his belief in a two-tiered private for-profit system.
Next question.
Hi, Mr. Trudeau. Mercedes Stevenson, Global News. You've spent a lot of time attacking Mr. O'Toole over the past few days and his policies. The Conservatives have released their platform, but you've not yet released yours. Will you commit to doing so before the debates take place next week?
I look forward to sharing all of our big ideas for this country over the coming weeks. I know that Canadians have been through a difficult year with this pandemic, challenges faced both in the immediate, but also reflections on how we need to improve Canada for the coming years. And just as we had people's back during this pandemic, we will continue to have their backs in the years to come. With an ambitious plan that invests in Canadians, invests in housing, invests in fighting against climate change and creating good jobs, investing in families with childcare and supports for seniors. I'm excited about all the ambitious ideas we have to share with Canadians, and we will share them throughout this campaign. Nous avons une vision ambitieuse pour l'avenir de ce pays, et on a vraiment vu les besoins pour cela pendant la pandémie, les vulnérabilités, le besoin d'améliorer nos processus en matière de santé, mais aussi notre lutte contre les changements climatiques, nos soins pour les plus vulnérables, pour nos aînés, pour les plus jeunes. Nous allons être là avec une vision ambitieuse de l'avenir qui fait très clairement contraste à l'idée de revenir en arrière de M. O'Toole. C'est un moment pour avancer ensemble et c'est exactement ce qu'on va faire.
Following up.
I don't think that answers the question of whether or not you'll commit to releasing it before next week, but I do also want to ask you about Afghanistan. There are now some Canadian forces around the airport basically standing guard. They're not able to pull people through the crowds, which are about half a kilometer long, according to sources on the ground. They say the IRCC is still giving people unclear and dangerous directions to go to the airport. They're not communicating where potential Taliban checkpoints could be. What are you doing to get people to the airport more safely, and are you negotiating with the Taliban, as other countries have, to try to get our citizens past their checkpoints?
First of all, everyone within the Canadian government's Foreign Affairs Department and our military is very much focused on getting people out to safety. IRCC is working around the clock to both process and give people the accurate information so they can get out to safety. Our forces on the ground have all the necessary authorizations to do what they feel is necessary to save as many people as quickly as possible. And we absolutely trust the extraordinary members of the Canadian Armed Forces who know well what the situation is on the ground and how to best help. We will continue to be there to support them. We will continue to be there to work with our allies to ensure that we're getting people out to safety, because that's what Canadians expect.
Prochaine question.
Hello, Karina Roman, CBC. You made a very similar announcement in 2019 at McMaster University than you're making today. Your own admission, we still have a major doctor shortage and have a waiting list problem. You have the provinces begging for an increase in health transfers, and you've said basically eventually. How can voters trust what you are promising today and that you'll actually fix the problem?
I think Canadians saw what this government did during the pandemic. We had their backs, including with historic, immediate transfers of billions of dollars to the provinces to help with the pressures on the healthcare system that this pandemic created. Yes, over the past year and a half, we've been focused on getting through this pandemic, but at the same time, we've continued to work on our commitment to get more primary care physicians for Canadians, more nurse practitioners. This is something that we have seen made easier in certain ways with the advent of technology and video conferencing in the medical fields that is going to make things a bit easier. But at the same time, we also know that making a concrete commitment of 7,500 new doctors and nurse practitioners across the country, primary care givers, is going to make a huge difference as we invest with the provinces in making that happen. You're right, it is something that has been a need for Canadians for a long time, and that's why we're continuing to step up.
In terms of the health transfers, you know, you've got Aaron O'Toole giving a number, you've got the other leaders saying that they will increase the health transfer. You've said eventually. Why are you so hesitant to put a number to it? When will we know what you would like to actually increase it to?
Because the focus that we have is not on simply transferring dollars, it's on creating outcomes for Canadians. I think all Canadians know we have a great healthcare system, but all Canadians also know it could be better, and it needs to be better. And that's why we're going to work with the provinces on those outcomes to make sure that Canadians have access to primary care physicians, that Canadians have better access to the supports and services they need in their healthcare system, that we're reducing the backlogs and wait times, that we're there with an effective system that works well for everyone. While Erin O'Toole is trying to make it so that the wealthier have better access to private care than everyone else, we know that a universal public healthcare system is right for Canada, is something that Canadians want to see defended. That's exactly what we're focused on. For years and even decades, the conversation about healthcare has been how much money we're investing. We're much more interested in how we're actually helping Canadians, how Canadians are getting the results in their healthcare system that they need, rather than governments talking about billions going into it.
Prochaine question.
Bonjour, M. Trudeau. Catherine Lévesque de la presse canadienne. Je voulais poursuivre sur la lancée de ma collègue parce que les autres partis sont très clairs. Le NPD, le Bloc québécois sont d'accord avec les revendications des provinces pour les transferts en santé. M. O'Toole a donné un chiffre, 6 %. Vous, quel est votre chiffre? Est-ce que vous avez un pourcentage à nous offrir aujourd'hui ou est-ce que ça va être des ententes à la pièce avec conditions comme vous?
Ça fait des années qu'au Canada, on parle d'investissement en santé. 1 milliard de plus ici, 100 millions de plus ici, plusieurs milliards de dollars là. On parle toujours de l'argent qu'on investit en santé. On ne parle pas assez souvent des résultats en santé, de l'impact dans la vie des Canadiens qui se cherchent un médecin de famille, mais qui ne trouvent pas, qui font face à de longues files d'attente pour les services spécialisés dont ils ont besoin. On a besoin de se concentrer sur ce dont les Canadiens ont besoin. Et c'est cette approche-là que nous avons en tant que gouvernement. Oui, comme on a démontré dans cette pandémie, on va être là pour investir, pour envoyer des milliards de dollars aux provinces pour améliorer le système de santé. Mais ce à quoi les Canadiens s'attendent, c'est aussi d'avoir des résultats clairs et tangibles en termes d'amélioration de notre système de santé publique et universelle, et c'est exactement ce qu'on va faire.
En suivi?
Parlant de résultats, vos 7 500 travailleurs de la santé, vous allez les trouver où? Est-ce que c'est le fédéral qui engage maintenant?
Pas du tout. On sait qu'il y a des besoins pour des infirmières, pour des médecins à travers le pays pour que les gens puissent avoir un médecin de famille, de l'aide directe. Et nous allons donc travailler avec les provinces et territoires pour s'assurer qu'ils ont les effectifs en termes de ressources humaines dont ils ont besoin pour répondre à la demande des Canadiens. Encore une fois, on met les Canadiens eux-mêmes au centre de nos investissements en santé pour avoir des résultats concrets pour eux, pendant que M. O'Toole parle encore une fois d'un système à deux vitesses.
Next question.
Mr. Trudeau, good morning. Rafi Vijaykanyan, CBC News. You just said you would agree with sanctions against the Taliban government. How much of a double-edged sword is it for you to be talking about this publicly while Canada's still trying to get people out of Afghanistan?
The Taliban is a terrorist entity. Canada already recognizes and has for long that the Taliban are terrorists and harbor terrorists. That's why they're on the terrorist list. So yes, we can talk about sanctions when we've already talked about our condemnation and disagreement with the Taliban as an entity. So I look forward to those conversations at the same time as we work as hard as we can to get as many Canadians and vulnerable people home as possible.
Following up.
And for months while you've been in government, provinces and territories have been asking for a 35% or $28 billion annual increase in healthcare transfers. So why these piecemeal announcements during an election campaign instead?
Over the past 17 months, we have transferred more money to the provinces for healthcare than ever before in Canada's history. We have demonstrated as a government that we have people's backs. Unlike the Conservatives that are once again talking about private, for-profit healthcare, we know that investing in a public, universal healthcare system matters to Canadians. We stepped up during this pandemic, and we're going to continue to step up with health transfers to the provinces over the coming years. But our focus has to be on delivering outcomes and results for Canadians. We can't just talk about, oh, healthcare must be great because we've invested X many billions of dollars in it. That's not good enough for Canadians. That's what we've learned throughout this pandemic, that we need to see real results for Canadians. And that's why we're working in partnership with the provinces to make sure that Canadians get the results in terms of care that they need.
Next question.
Good morning, Prime Minister. Jordan Press with the Canadian Press. I just wanted to ask you something quickly on Afghanistan, which is you're talking about getting interpreters out and people who have worked with us. What about LGBT people? What about young women? What about young men who are potentially at risk?
Yes, we want to get all of those people out as well. Obviously, there is going to be a significant challenge, logistical challenges of getting people to the airport and on planes and out of the country as we've seen the chaos, the pressure, the challenges of Taliban checkpoints. Our priority, of course, first and foremost, are Canadian citizens. Next are people who've worked with Canadians, who've been there to support us, but we're also very interested in activists and human rights leaders, in journalists and people who over the past many years have fought and delivered improvements for people in Afghanistan. We know those people need to be brought to safety, and we, alongside our allies, will be doing everything we can for all the categories you mentioned and more.
On va prendre une dernière question.
Bonjour, Adrien Blanc, Radio-Canada en Acadie. On voit que la situation reste tendue dans la baie Sainte-Marie. Un chef autochtone a été arrêté. Il y a une incertitude sur la présence des agents des pêches. Est-ce que votre gouvernement restera dans la situation qu'on a vue ces dernières années, ou est-ce qu'il va adopter une autre approche pour les droits de pêche des Autochtones tout en conservant la ressource?
L'approche que nous avons depuis des années, c'est de travailler en partenariat avec les communautés autochtones pour reconnaître leurs droits qui sont reconnus depuis des décennies maintenant et pour les articuler concrètement en résultat pour la communauté, tout en respectant évidemment les exigences de la science de protéger la conservation de nos océans. On est en train de travailler de bonne foi en partenariat avec les communautés autochtones et avec les pêcheurs à travers la province, la région. Nous allons continuer de le faire. Ce n'est pas une situation facile ou immédiate qu'on pourra résoudre, mais on a démontré qu'on est en train de travailler de la bonne façon pour avoir les résultats que tous les Canadiens s'attendent de voir, de reconnaître les droits qui sont là des peuples autochtones, mais aussi de s'assurer que ça soit fait de la bonne façon.
Merci beaucoup. C'est ce qui met fin à la conférence de presse aujourd'hui.
Merci tout le monde.